This presentation is about Adr reporting culture. The aim of the presentation is to characterize the elements of culture, to discuss the problem of underreporting, and to identify methods and interventions to stimulate Adr reporting. My name is Hegerius, I'm a pharmacist, and I joined UMC in 2005. So, what is culture? There are obviously different definitions, but one is the way we do things around here. It is something that is familiar and accepted. Countries are very different. The first thing you notice when you visit another country is probably the people. How do they dress? How do they greet each other? What language do they speak? What do they eat and drink? What are their views on health and medicines? What are their religious beliefs? What kind of art and architecture is common? And so on. Countries have different cultures, but that is also true for organizations and systems. Each organization has some shared elements, like values, norms, and beliefs. There are many kinds of organizations. An organization can, for example, be very hierarchical, very flat, or anything in between. Usually, an organization that involves and engages people has a clear vision, a shared purpose, trust, openness, good collaboration and communication, clear benefits, and appreciation. Personal relationships are very important. This is a cartoon making fun of corporate culture, but we shouldn't really underestimate the impact of culture. We live in our culture every day, but we probably don't pay it much attention. Think of it as the environment in which your strategy will either blossom or fail. Creating and maintaining a successful reporting culture with diverse and remote audiences requires time, hard work, and personal commitment. A successful public service organization pays careful attention to the outside world. You need to interact with your target groups, listen to what they say, and be able to adapt to their needs. Why is there a need to develop a positive reporting culture? Is underreporting really a concern? Yes, indeed. According to a Swedish study, more than 90% of the serious ADRs are unreported. Obviously, the situation is even worse for non-serious ADRs. These figures are likely even underestimated, since the reporting rate in Sweden is higher than in many other countries. Underreporting is a global problem. In low and middle income countries, pharmacovigilance is often regarded as a luxury, since the priority may rather be access to drugs and there is little focus on safety due to limited resources. It's important to also be aware of the factors that trigger ADR reporting. For obvious reasons, doctors are more likely to report if the reactions are serious or unexpected. New drugs generate more reports than old, which is natural. Media publicity of a specific drug ADR association will also increase reporting. If the PV Center promotes reporting, the rate will also go up. And another factor is the relationship between the doctor and the patient. A patient who trusts the doctor is more likely to tell about ADRs, and a doctor who takes the patient seriously is more likely to report ADRs. If you search the literature, you will find a great number of so-called KAP studies, which stands for Knowledge, Attitude and Practice, or Perception. There are studies from all over the world and on all target groups, like doctors, dentists, nurses, pharmacists, healthcare workers, students, and patients. After reading these studies, it's evident that the conclusions have some things in common. Healthcare professionals are in general very positive towards reporting, but due to many different reasons, they still don't report. Many doctors are unaware of pharmacovigilance and PV centers. When asked, they say that they would prefer to report directly via patient records. They would like to receive proper feedback on reporting, and they are open to training. This study from India looked at the awareness of pharmacovigilance among 160 doctors at the teaching hospital. The majority of the doctors had heard the term pharmacovigilance, but only 25% knew the actual meaning of it. Only 16% knew about the PV program of India, PVPI, but about 30% were aware of Adr reporting centers. Almost all were positive towards training. Since this study was performed in 2012, and there has been a rapid PV development in India since then, the outcome would probably be better if the study was repeated today. In general, there is a lack of information about pharmacovigilance and Adr reporting. According to many studies, one of the main reasons for not reporting is that there are no forms available, and if there are, the forms are often not very good. There is also a lack of routines, reporting culture, and motivation. If my colleagues don't report, why should I? Of course, doctors are very pressed by time, and it's hard to blame them for prioritizing direct patient care to paperwork that may help patients in a longer perspective. In addition to the lack of time, there are many other common reasons for not reporting ADRs, such as failure to recognize the ADR, uncertain causality, and fear of legal liability. A recent study from Saudi Arabia shows some of the most common constraints for ADR reporting. More than half of the healthcare professionals responded that they don't have access to reporting forms, they don't know how to report ADRs, the reporting form is too complicated, and reporting is too time-consuming. 40% believe that all ADRs are already known. Furthermore, the study showed that almost 60% of the healthcare professionals in the survey were unaware of the National PV Center. There are some very common but false beliefs about ADR reporting. As we could see from the previous study, many healthcare professionals think that serious ADRs are already well known when a drug is marketed. Many also refrain from reporting if they are not certain about the causality, although it's enough with a suspicion. It's also common to think that reporting a single case doesn't make any difference. This research article from Pakistan was published earlier this year. It's a KAP study on pharmacy and medical students. The pharmacy students seem to have more knowledge about ADRs than the medical students, but both groups have a poor knowledge of pharmacovigilance. It is remarkable that not even 10% of the medical students believe that ADRs could be fatal if not identified and managed. Now we have looked at the importance of culture and the awareness and attitudes among reporters. We have identified the most common reasons for not reporting. So what can be done to improve the situation? The question of mandatory reporting to increase reporting rates often comes up. This is a Canadian article from 2013, where they debated whether or not to enforce mandatory reporting for healthcare professionals. Since there are no consequences for healthcare professionals who don't report ADRs, even though it's mandatory, the effect of this regulation will probably be low. However, it is a statement that shows a political will which strengthens the role of the PV Center. Sweden has had mandatory reporting for doctors and dentists since 1975 and has a fairly high reporting rate compared to many other countries, but still, many Swedish doctors have never reported an ADR. Nurses, pharmacists, and patients should also contribute to reporting. Nurses are closer to the patients. They have more time to listen to them and observe drug-related problems. Many problems can also be picked up at the pharmacy. Patient reporting can be a valuable complement to healthcare professional reporting, especially for OTC drugs. An Australian study from 2013 concluded that only 10% of the consumers in the survey were aware of direct patient reporting, although it has been possible since 1964. Furthermore, doctors may not take their patients seriously when they report ADRs. A US study from 2007 looked at physicians' response when patients reported potential ADRs. They found that physicians were more likely to deny than affirm the possibility of a connection. Rejection of a possible connection was reported to occur even for symptoms with strong literature support for a drug connection. A public ADR reporting campaign can be effective. This leaflet and billboard are from a successful public campaign in Croatia, performed by the National PV Center, Halmed. They also participated in radio shows, and the campaign had a big impact. The goal was to increase reporting from patients, but an added bonus was that the reporting rate for healthcare professionals also went up, thanks to the publicity. If there are too limited resources for a campaign, PV centers could still provide healthcare professionals with important information about PV and ADR reporting, but think about the communication channel. This graph is also from the research article from Pakistan. It shows where the pharmacy and medical students look for ADR information. While the pharmacy students use internet as the main source, the majority of the medical students rely on textbooks. Because of this, it may be a challenge to reach the doctors with safety information if you mainly rely on your website to communicate. The communication channels used by PV centers should be carefully selected, tested, and evaluated. Educational interventions generally increase reporting, but the effect is only temporary. Therefore, continuous efforts are needed, and ideally, there should be an ongoing dialogue between the PV center and healthcare professionals. It is more effective with training that boosts active participation compared to traditional lectures. Another option that may be effective is to collaborate with professional organizations such as doctors and pharmacists associations. Contact them and ask if someone from the PV Center could come to one of their meetings and talk about pharmacovigilance. Pharmacovigilance should also preferably be incorporated in the university curricula for the next generation of healthcare professionals. If the students understand the importance of pharmacovigilance, they are more likely to contribute to ADR reporting in their professional life. One of the most important interventions to increase reporting is to facilitate the reporting process. Know your target group, find out what motivates or prevents reporting, and in what way the healthcare professionals prefer to report. Make sure that forms are available. Online ADR forms should be easy to find on the PV Center website. Perhaps a hyperlink to an online reporting form could be added to the doctor's desktop. If the reporting form is not good enough, improve it. Some hospitals have established ADR reporting networks in order to discuss suspected ADRs and encourage each other to report. What about mobile apps? Almost everyone has a smartphone nowadays. The key aspect is to provide a quick and easy way of reporting. This is another extract from the Canadian article I showed previously. The doctors were not very keen on mandatory reporting. Instead, they requested Health Canada to make the existing system more user-friendly. Feedback on reporting is extremely important. The minimum feedback is a thank you note. But even better is, of course, if the PV Center could also include some data of interest to the reporter. For example, the number of reports received on the same drug ADR combination or the outcome of the causality assessment. The key is to show that the contribution was valuable. This is, however, time-consuming, and many PV centers lack resources for this. Free training and educational credits could be an incentive for Adr reporting. In Eritrea, they handed out pharmacovigilance awards to the 6 doctors who accounted for 50% of all Adr reports. This is a nice way to acknowledge the work of these doctors and to encourage them to keep up the good work. Other incentives could, for example, be vouchers or gifts. If we go back to the Canadian debate about mandatory reporting, the doctors complained that they didn't get any feedback and they requested increased transparency. Since the articles I have shown were published a few years ago, you may wonder what the outcome was in Canada. There has been a proposal of changes in the regulation, making Adr reporting mandatory for certain healthcare institutions, but discussions are currently ongoing with different stakeholders. To summarize this presentation, there are many interventions, but none will work unless there is an overall positive and collaborative culture holding it all together. The reporters need to feel that their contribution to patient safety really matters and that there is a purpose. Multiple interventions have a greater impact than single, but they all fade over time, so repetition is crucial. The key message of this presentation is that a positive Adr reporting culture depends on active and collaborative relationships between all parties.